Hello, good people. How are you today? I hope that you are doing well and that you are in perfect peace in every area of your life. Today is June 23rd, which makes it the 23rd day of Uterine Cancer Awareness Month. As a uterine health advocate, I have been committed to posting every day in the month of June with information and topics regarding uterine cancer and uterine health. So today is day 23. I also want to take the time to say thank you. Thank you for your engagement with this channel, from watching the videos to subscribing, liking, commenting, and all the things. Your engagement is greatly appreciated. So I like to say this verbally, although it is also in the description, that I am not a medical doctor. I am a uterine health advocate. Okay. So today I want to speak to you about the holistic options for uterine health. So far, I've been sharing, various treatment options via modern medicine, but I would be remiss if I did not also mention holistic treatments as an option as well, because I think that that's an important subject to talk about as well. I've seen quite a bit of social media advertisement, I'm going to say, or people making posts about various herbs and tonics and tinctures, I think they call them, where they provide, some sort of healings for many symptoms that impact the uterus and the uterine health. I know that there are plenty of people that, believe only in modern medicine. And I know that there are those that only believe in a holistic journey for their healing. And I know that there are people that believe in both right? This is my take on this. This is your body. You know the symptoms that you're facing. And so you should be doing your due diligence to see what is bringing you healing for your body. What will bring you healing for your body, whether it's holistic medicine or both. So as you're looking at various things that say they can do this, they can do that, I'm always saying, do your research, whether it's holistic or modern medicine, right? So again, I highly encourage you, like I said, to do your research. I have shared, lots of information about, how you can have the latest cure in modern medicine. But herbs, you need to really, just like medicine, you need to do your research, because you may pick up something and someone says this is good for, your uterine health and this is great. But when you do your research, you'll find that it's more for helping women with fertility issues. So that may not be a good source for a person that's postmenopausal that is having abnormal bleeding. And then you also need to pay attention to, if you're already on a prescribed medicine from your medical doctor, that you don't take anything that will bring any kind of negative reaction to your body, and that may be counteractive what you're already taking that's bringing you some sort of healing. So you need to be able to know what exactly you're putting in your body and how the herbs are going to work for your body. Okay. So I went quickly online to ask the question about what is holistic means for uterine health. And so holistic uterine health relies on three things. The first thing it relies on is reducing inflammation in the body. The second thing it relies on is balancing hormones. The third thing it relies on is improving pelvic blood flow. So when you adopt all of these when you adopt all these three things, you can also have a diet that's anti-inflammatory. You can use beneficial herbs, it says, and you can have stress management. So the three things is reducing inflammation, balancing your hormones, and improving your pelvic blood flow. And so when it talks about having an anti-inflammatory diet and nutrition, it talks about three major things. It talks about having a diet with omega-3 fatty acids, which include, wild-caught fish, flax seeds, and walnuts. It helps to bring down the inflammation in your body that may trigger like some kind of uterine conditions and any kind of pain that you're having there. But again, this is why I say you do your research, because you may need to find another alternative, because maybe you might be allergic to walnuts, or you might not like fish or might be allergic to it. Another area in your diet could be you need to have fibroid antioxidants. That's a diet rich in beans and lentils and whole grains and brightly colored vegetables that flushes out the excess estrogen and protects the reproductive tissue. And I've done a number of videos that, we see that when you have a high estrogen level, the causes that it can happen to your body. So having fiber and antioxidants helps to flush out excess, estrogen. And they talk about having, taking vitamin D and vitamin A. They said these vitamins support healthy tissue growth and are crucial for minimizing conditions like fibroid. So these are things that you can look, if you're not already taking a supplement, like a multi-supplement, to see if they are in it, or if you think you need to take extra. Again, these are things that you can talk to your doctor about, and they should be able to help you. The second thing that they say that is very good for you for your uterine health, holistic uterine health journey, is having supportive herbs, or you can say herbs. People say it differently. So there are 4 things that they have listed here. The first herb that they say is red raspberry leaf, and it's known as the uterine toxin tonic, and it strengthens the uterine muscle and eases menstrual cramp. The second thing they say is turmeric. They said it's a potent anti-inflammatory property that can assist in managing endometriosis and fibroids by suppressing excess tissue growth. The third thing herb that they mentioned is Vitex, which is also known as chasteberry. It helps regulate the pituitary gland to balance hormones and to stabilize the menstrual cycle. The fourth herb that they recommend is ginger and chamomile, because they said it's excellent for relaxing the uterus and reducing inflammation and relieving PMS, which is premenstrual cycle. So the last thing they also mention is your stress, your lifestyle, and your stress management. They did mention pelvic blood flow. They saying moderate, exercise like yoga and walking increases circulation to the uterus. So this is just, a suggestion. You may not like yoga, you may not like walking, maybe you do prefer biking, maybe you're already, working out or doing some kind of movement to keep the pelvic blood flow going. They just said it needs to be consistent exercise, is what they said, moderate and consistent. So you don't have to go overboard, but you need to be doing something. And then they also list mindfulness, which is, when you think about it, our high stress levels, negatively impact our hormones. And holistic care practice such as acupuncture, warm baths, and meditation can help. You don't have to do an acupuncture. You don't have to do meditation, because I know some people hear acupuncture, they have different, thoughts about it. Meditation, they have some people look at that word kind of negatively sometimes, but, they mention warm baths. So you can look at different things on your own to, see how in your lifestyle you can manage your stress. So when I was looking at this, I said, well, how do I find out if there are any, where do I find out a holistic doctor or something like that? Or is there a holistic doctor? And yes, there is. So here we go. So some holistic doctors have traditional medical degrees. They pair their conventional medical training with holistic approaches. Other providers may not have any medical degree. However, they have, various levels of experience and things of that nature. So I am going to give you the 6 types of holistic doctors that you can see, doctors, practitioners that you can see. The first one is an integrative medical doctor, and their title would be MD. And when I say their title, you know how you see a doctor or a person and they have a comma and they have MD, PhD, masters of this, BA of this. That's what I mean when I say title. So it's an MD. And this person is a fully licensed medical doctor, and they combine traditional medical care with whole body techniques. The second type of doctor is a doctor of osteopathic medicine, and their title is DO. And they are fully licensed medical doctors. They emphasize the whole person approach to patient care. So rather than just treating the symptom, or the disease, they look at at your lifestyle, they look at your environment and different things that impact your overall well-being. The third type of doctor is under this category is the doctor of chiropractic medicine, which their title is DC. They use a hand-on approach to manipulate your joints. They work to reduce your pain and correct your body's alignment. The fourth doctor is a doctor of naturopathic medicine, and their title is ND. N is in Nancy. And they use a combination also of traditional medical science, holistic approaches, and natural therapies. The fifth doctor is a Chinese herbalist, or maybe I should say practitioner, not doctor. So their title is TCM, the Chinese herbalist. And so I'm going to call them a practitioner. I want to make sure I get that right. They are not a doctor. They are a practitioner. And they use herbal formulas, often alongside with acupuncture, to balance the body's injuries. The final and sixth thing is a herbalist. The herbalists, they primarily focus on using plants for healing and wellness, and they have various level of training and are not typically licensed medical doctors, although some prefer to call themselves medical herbalists because they have some extensive clinical training. So I'm just going to repeat the names again for you so you'll know. You have your integrative medical doctor, your doctor of osteopathic medicine, the doctor of chiropractic medicine, the doctor of naturopathic medicine. You have your practitioner, which is the traditional Chinese medicine, and then you have your herbalist. Those are your six options. And then what I found out is when you go to a herbalist, because they're not typically, licensed, let's say like a medical doctor, you can verify if they're registered with their credentials. And I will put this in the description with directories like the American Herbalist Guild registered herbalists. You can check there to find a practitioner that may have had some kind of, additional training outside of just their own personal research. There are also some herbalists that have specialized certificates that they may have taken to really learn about the herbs and what they really can do. And sometimes they complete like a multi-year course or hands-on training and not just something maybe they picked up online. So you can verify when you talk to them. So when you're choosing a looking in search for herbalists, you can verify their credentials. Excuse me, verify their credentials. Secondly, you can determine their approach to how they practice, which is something that I think that you can even determine that with a medical doctor, right? So there are clinical herbalists that focus on one-on-one consultation, and they analyze your full health history to create a custom herbal protocol for your specific condition. There are community herbalists that focus on teaching and preventive care, and they will show you what you need to do so you can make your own herbs or take your own herbs at home. And then there's your traditional herbalists that are focuses on folklore, plant spirit healing, and other cultural traditions. That really primarily focuses on the spiritual and the cultural traditions of that group of people. The other thing that they say that you should do is you should ask key questions, which I'm definitely pro that, right? So they said never hesitate to interview a herbalist before starting a regimen. I think that's the same thing that can go for a medical doctor, right? So when you're talking to a herbalist, and you're trying to figure out if that's the right herbalist for you, you need to ask them, where did you receive your training and how long was your program? And then go look that up and do your research. Do you have experience working with my specific health concerns? If they are a herbalist that's maybe been working for a while, maybe look online and see if they have any references, any reviews or something like that. And then what I thought was really cool was, how do you source your herbs? Do you test them for heavy metals or purity? Because if you're choosing a holistic journey, you do want to make sure that it's a pure herb that's entering into your body, right? Because you want to keep it holistic. The other thing they talk about is ensuring your safety in your collaboration. And they said a responsible herbalist will ask you about any current medications that you're on and any kind of current medical conditions to prevent adverse interactions, which I am wholeheartedly for. And they should be willing to collaborate with your primary care, your doctor team, in case they may have any questions that they think that you should be doing. I think that is very care, because your safety is the most important, whether you're a herbalist, holistic doctor, or regular doctor. And then lastly, you should evaluate your fit when you're searching for a herbalist, because they don't really have like a medical training like medical doctors do, but you do see that there are things offered out there. Make sure that they're not out there just excuse me, making claims that just seem too good to be true. But I want to put a pin here. One second. Excuse me, I had a really bad coughing spell. Anyway, we were talking about making sure that the herbalist is a good fit for you, and that you should make sure that as you're asking them questions, that they're not making some, too good to be true type of information that doesn't allow, they say, unverified medical claims, or if they dismiss like traditional medicine, or if they, have a hard time explaining to you why they're giving you this herbal recommendation, consider seeking an alternative provider. I think that is the same thing about a medical doctor. When my doctor, when I, when my uterine lining was expanding and my doctor said that she was going to put me on progesterone, I did ask questions like, why are you putting me on progesterone? And she was very quick to answer my question, and I was very satisfied with it. But of course, I did my research as well. When they talk about, I just want to put a pin here. When they talk about unverified medical claims, that can be very tricky, right? Because the plants were here before modern medicine. So I do believe that some of it does work to do what it says it's going to do. And because it hasn't been tested scientifically, doesn't count it out to me. But you have to do your own research, and you know in your gut and you feel it in your soul if something just doesn't seem right. If they say that this thing is the cure to everything, what proof do they have of that? That's what I would want to know. But I'd want to know that for the doctor as well too. So where's your data? Where's your statistical information? Just kind of get a feeling in you'll know. And so I also looked up too that, some insurance companies do cover, I should say, holistic options under your plan. So look at that as you're choosing a doctor. I'm not sure if they pay for Herbalists, but they may pay, may cover some of the other doctors you want to go to as well. Again, I say to work with your doctor before you just choose to take any kind of herb or any kind of, thing that you want to do, especially if you're already on some type of medication. Again, I say I believe in both. I believe in modern medicine, but I also believe in holistic approaches. But holistic can be a whole lot of things. Holistic is just not herbs. Again, we saw here where it talks about your lifestyle and your stress management. Are you living a stressful life? And you have some choices and removing some of those stresses from your life. So those are things to just to consider as well. So I'm not here to challenge anyone's cultural traditions about, whether they should or shouldn't use herbs and go to a holistic doctor. I'm not willing to I'm not challenging culture traditions, or I'm not challenging your grandmother's tincture she's given you for healing that has worked for generations in the family. I mean, I'm not doing it. Hey, who am I to complain? We still believe in ginger ale, and crackers. So I don't know where that comes from, but so I don't challenge anybody on it. Again, this is your body. I think you should choose what's best for you when you're going down a route of feeling what's holistic, what's best for you and your body. So I do have 3 references that will also be in the, that will also be in the description. The first one is from South Lake OBGNY. It's from July 2025, The Best Herbs for Your Uterine Health, a Natural Guide to Wellness. The second one is from the American Association of Naturopathic Physicians. What is a naturopathic doctor? The third one is from the Cleveland Clinic. What is a holistic doctor? So I thought these was really good. And then I'm also going to put in that link where you can check to see for any registered herbalists in their credentials in that in your area. So I hope that this, broad overview was very helpful for you. And that you can make the right decision, whatever you need to do for you in your life. So once again, thanks so much for engaging with this channel. I hope that you have a great and very pleasant day.